Thank you everybody for coming in. My name is Chris Chia. We're here in New York. Today's procedure will be the Embrace protocol, which will entail the following procedures: tumescent anesthesia of the neck, followed by radio frequency bipolar application energy of the neck, lower third of the face and the jowls, upper bluff, as well as a lateral or upper forehead lift. We're going to finish that procedure today with the Morpheus8, which is a microneedling pin array, which is coated and a distal tip applying a radio frequency not just into the skin but through the skin to the subcutaneous collagen matrix, which is a unique player in this arena. Donna is a very healthy, non-smoking 58-year-old woman, and was complaining of a little bit of neck laxity as well as some jowling of the lower third of the face. Just to go over the marks, the jowls are here. You use a marionette lines as an anatomical locator, arbitrarily marking off the medial portion of the treatment zone here as a so-called no-fly zone, as my partner Spiro Theodore likes to talk about, because of where the likely traversing of the marginal branch of mandibular nerve, about 1 centimeter lateral to the malleolus, down to the angle of the jaw. We turn closely this way, thank you. The anterior border SCM, cervical mastoid, will be the posterior area of the treatment zone, because rarely we need to go beyond that. We're all familiar with our facelift history, that it's very adherent to the soft tissue, so you don't really have to do anything there. First cervical line that we all have here, and if we need to go beyond that for a qualitative improvement of the skin, we'll use a Morpheus. But as far as the working end of the FaceTite device is about 10 centimeters in length, with about a 1.5 centimeter open electrode on the internal part. We'll get into all that later, but let's go ahead and use tumescent to get her going. This may take a few minutes. We're going to go nice and slowly. See, in the South they call it slow and slow, like barbecuing. In the awake patient, you want to make sure that they're comfortable and safe. We already know this of this with 1% width. Going in a small sub-cube fast pace. Very slow speed. I don't think I appreciate we're just using the hydraulic force, general force of the fluid just to do this section for us. This is a 3.5-inch yellow hub 20 gauge spinal needle. Sure, it's sharp on the end, but if you feel comfortable with it, by all means. If you want to prefer to use a blunt standard infiltration cannula, that's fine also. But this is the small aperture of the needle, I think, restricts the flow and it goes nice and slowly. And the equivalent of stimulation is the rate of distension. You want to go nice and slowly. The tumescent we're using is a modified Klein, basically 0.1% lidocaine, which is in a 500 cc bag of saline or Ringer's. It's 500 milligrams of lidocaine, 0.75 cc's of 1 to 1,000 concentration epinephrine, and a little bit of bicarb, just to cut the pH in the weak patient. Makes a difference. So this part takes a little long. It's worthwhile going slowly. Make sure the patient's comfortable. You okay now? Great patient. And we have some colleagues from Tennessee and Connecticut also. They're very familiar with local procedure in the office. This can be done. We're doing it in a accredited operating room, but this is easily and safely done and effectively done in a well-equipped procedure room. And throughout the country, we see this done every day. Practice friendly in terms of usage of we autoclave everything we can, and disposables include the hand pieces, the tips, and I suture things closed. By convention, we'll treat the neck first in its entirety, at least up to the kneeling part, and then I like to do the jowl and the upper face last. The question was, if we didn't picked on my doctor was asking, I guess in general, how much volume? I tumescent a lot, so you may want to use more tumescent when you start using the device for the following reasons. I think it helps the passage of the instrument when it's nice and taut. The water itself in the tumescent will be a significant heat sink because the specific heat of water is high. So you get a secondary heat effect from that. You want it to be nice and even. And thirdly, it's just, thank you, it's just easier to do the resection after. Some of our colleagues who've been doing a lot of this feel comfortable doing the tumescent suctioning and then RFing, which is totally fine. But I think in the beginning when we start using the device, it's easier to do it this way. So that animation just shows the larger body type device. A couple take-home messages, very simple, easy to use, is that you want to have a distance between the subdermis, the undersurface of the skin, and the internal working part of the probe, which is different than the one on the surface. You want to have good contact in using sterile ultrasound gel, for instance, to maintain good contact. The reason is that as an EM or electromagnetic device, the FaceTite body type machine is quote unquote tuned to a certain sort of impedance and expects to be operating in a water or hydraulic medium. If you touch the probe to the surface of the skin and it heats up too quickly, one of the safety mechanisms will shut it off, which is terrific. But you want to be aware of that and just not keep doing it because you may have inadvertent heat deposition more quickly than you think. All right. Donna, you're awesome. By the way, she got 10 or 20 of volume? 20 of volume. 1 Vicodin or 5 milligrams of hydrocodone and 325 of Tylenol. And an appropriate antibiotic, probably complex. If you look at the screen in the lower right-hand corner, it's very simple. Kind of like you talking earlier, it's like a dual zone temperature control in your car. The outside, or mostly the skin soft tissue, you want to have a target temperature of about 39.5. In the neck, I do 39.5, please, Wanda.
Okay. 39.5?
And 60 internally.
Okay.
So it's a bipolar device, and by design, it's an asymmetrically applied energy, so it's hotter on the inside than the outside. By design, because you want your soft tissue, including the skin on the outside, to be about the target temperature in the 40 degrees centigrade range, but that's inadequate for the internal fibroseptal network, or FSN. You want to get it up to at least 60 degrees, and in the neck, in the body, you may go even higher, and it makes minor adjustments depending on what part of the body we're treating. And that ensures that you're going to recruit as much of the collagen, both by initial thermal impact, which you see on the table, and then more importantly, later on, when it responds with neocollagenesis, we're making more collagen over time. We're trying to stimulate it to make more. Okay. The neck is pretty good. We got about 200 now. I'm going to end up putting a little more, but I'm going to actually do the jowl now. She should have good analgesia here, and then we're going to go ahead and do this. And by injecting the areas now, we're going to actually allow the analgesia to work mostly, and then have some absorption of the fluid, because remember, we're not going to suction above the mandible anyway, so it'll help us just identify the anatomy better. Oh, this is a 14 gauge, you know. We could use a puncture. You could use a no pour or a skin biopsy punch, but you don't need to take it. When we're looking at classifications, you know, we like to classify everything. And the low end of the scale, whatever it is, say in the Daniel C. Baker classification, 1 through 5, 1 would be very minimal, and then 5 would you need to open the neck and face. And she's probably in between the lower third of face jowling as well as the neck. She has good skin elasticity overall. I'm trying to get her pre-op pictures. And in good health. And she's a good candidate for this as either as a procedure on its own, a temporizing procedure. If she does undergo a traditional procedure, say 2 or 3 years down the line, you can leave it there. Thank you. But certainly something we can do, which has a quicker recovery. she's not, I'm not talking about her in particular, but in general, so yeah, we have patients come in and say, I'm not ready for my face and neck maybe 2 or 3 years, but my nephew's getting married in the fall, what can we do about that? This is a perfect adjunct, or as this girl calls it, a gap procedure, which I think is a good term for it, because it's, you're not going to get the 100% reaction of the traditional procedure, but you don't have the time and financial considerations as well as recovery. Okay, here's the animation here we're going to talk about. So that red zone indicates the so-called no-fly zone near where the sweep of the marginal branch would be. Those arrows indicate the vector of tightening that we can use. That port we'll use later on. I'll talk about that with an 18 gauge, which is nice because it doesn't leave any scar, literally. This is the FaceTite device going on the over mandible. That red circle shows that we don't want to heat proximally to the axis incision point on the face about 1 centimeter, on the body about 2 centimeters. The reason is just like we don't want to over liposuction an area, you may inadvertently deposit more energy as the zone of treatment tapers down close to the axis point. That shows that you want to have multiple points, you want to be in the right plane, obviously. Paulo Rovati indicates calls this the cephalad rotation under the kind of inner table of the mandible. We can get nice thermal contraction. We're pre-platysmal the whole way here and suprasmas on the face. So unlike the trunk, where we're going to be under scarpas or SFS, this is actually pre-SFS, so superficial to it, and the lid is postseptal. This is the neck-tight device. So the working end from here to here is about 10 cm. Teflon coated tip, non-conducting, and naturally just like an electrical cord, this doesn't conduct either. So the hot part may not show up on the camera is about 2 millimeter exposed metallic portion. The bottom side of here is the electrode on the surface, which has which is going to touch the skin at all times, aided by ultrasound gel. And the idea is to make sure that the depth of it is inappropriately deep. So we just enter the axis incision here. She's a primary case, so I'm not concerned about pre-tunneling. Certainly patients who have previous lipo, face, neck lift, you can even follow some face and neck lift. Or more recently, Kybella, you may have some fibrous connections. And since this is relatively delicate and has some play to it, I would just take a small liposuction cannula under off suction and use it to undermine if necessary. But she's nice and easy here. So the first thing I do is assess my depth, which I feel with my non-operating hand, it feels good.
This is where we set our presets. Dr. Chia had me at 39.5 on our external, and our internal is at 60 degrees Celsius. This is where we have our sets. At the 120 just means our time on tissue, how long we can work without having to lift our foot off the pedal. And now over on the left part of the screen is where we're seeing what the actual temperatures are. Internal 28, external 39, 42, and then we have our total kilojoules delivered in the bottom left corner.
Thank you.
And we'll talk about as we go through the case the different sounds that we will hear and what those sounds mean and tell us.
So just like I want to mention, the nice thing about the audio feedback is I don't have to look at the screen the whole time. And we're just getting the tissues up to temperature, so it's not in the therapeutic range yet. So I don't have to look at the machine so much.
Well, we just heard a double beep, which means at one point we were then 1 to 2 degrees.
Have that little sound. I don't know if you can appreciate on the microphone, but you can hear the fat. You can hear that, right, guys? Just like a bovie goes, the fat gets coagulated. So we brought the doctors earlier brought a really good point. When in the face and say the breast and all those other areas with maintain volume, we don't want it. You don't want to have unintended lipolysis. You want to maintain volume in the face and other certain parts of the body, obviously. So the nice thing about the device is only the tissue that's between here is that's privy to the energy is going to get affected. So that in the jowl here, sure, it should have heavy jowl, but say we do other areas of different indication, other parts of the face don't maintain volume. Let me keep working, shut my app when I do things. You want to maintain volume that's nice, that's discrete. Unlike the other devices which are monopolar, including laser and other RF devices, where there's a lot of scatter, and you have a grounding pad like 2 feet away, you may have that unintended lipolysis. The audience can appreciate
look how nice
yes,
and-
that's a nice heat signature to. Can you get a temp reading?
Let's see. 42,
Oh, perfect.
41.
Okay, so this brings up the issue of rhythm or cadence. In general, because of the asymmetric nature of the energy deposition, the more slowly you go, that's internal, which is great. The internal temperature will rise more quickly the more slow you go. Okay, that's external, thank you. And conversely, the more quickly you go, let the external catch up. I'm happy with the external, so I'm going to slow it down a little bit. Because we're at 40 already, right?
Yeah, that's right.
Perfect.
Looks nice.
Okay. And then our theme, I don't know if you appreciate the camera, is actually what we expect, even with epi, you're going to get a reaction. So the zone of treatment, so since it's obviously a point source and we're doing an arc, we call it the pizza slice of treatment zone right there, and we'll do some overlapping from this post-auricular axis incision. And that's pretty much it. Nice. Just checking here first for passage and instrument. Nice and easy. And we're going to start the heating. Out of the way. Initially, I'm doing this is what we call the moving technique, just like when you inject filler, inject on withdrawal, or heating on withdrawal. But unlike that, as the device does its thing with multiple passes, it's a bogey of sorts, so it's going to subsize, and it gets easier to pass, so you go back and forth to literally double your efficiency. So now I'm going back and forth. Speeding up my rhythm a little bit. Look, I'm taking a quick peek over there.
32, 48, 33, 47.
TV screens are there. Yeah, good. So I'm going to slow her down a little bit here. See how I'm letting the intro catch up there. Perfect. Alright. So the 50s. So high 50s. 60 good. That real fast quad beat was the internal temperature. That double beat means I'm within a degree or two of one of my goals, in this case external temp. Good, so we're both at 39, 40, and 50s, almost 60. So at that point, there's no more energy being. Okay, if we can tilt that to the camera, that's great. So this, you see my finger there?
Mm-hmm.
So that's what we just treated. There's a little bit of residual heat from before. So when you have a large amount of fat, like in the trunk of the body, and you may want to aspirate some or just milk some fluid out, but in neck and face, the volumes are small. The reason for that is because the emulsified oils have a even higher specific heat than water. Just like in the Middle Ages when they used to throw vats of boiling oil over the wall to the marauders, they chose oil because it's a lot hotter and has a higher specific heat. Okay, so we treated this side of the neck, and just by convention we'll do the same on the other side. Any questions at all? Practice management, advice?
So you're trying to kind of manage the outer and the inner heat goals, and if you need a little more in the lower and the inner, you slow down.
Exactly.
And if you're trying to get the outer up, then you can go a little quicker.
Exactly right.
Okay.
Some of our colleagues that we visit that have been using the device also may come back to it. They'll cool down. They go up to external temp, right, Wanda? They'll cool it down and come back and do a very slow pass and get the internal temperature. I thought that was pretty neat too. You can,
Yes.
There's multiple ways of doing it. But I think the goals, plural, are probably a couple fold. I think one, you want the external temperature up to goal. Two, you want the internal temperature up to goal for sure. And whether one or the other is more important is subject to debate, but I think you should get both. And thirdly, what is your endpoint in terms of kilojoules? Well, in the body it might be variable, like someone with a bigger belly like myself, a certain number of kilojoules would be inadequate, whereas someone small like Wanda or whatever size people would be more than adequate, right? It's like, it's the old boiling a pot of water for 10 people or for 2 people. You still want to get it to 100 degrees centigrade, or whatever your altitude allows. But the amount of kilojoule to achieve that is going to be wildly different. That being said, in a face and neck, we don't have that much variability. So in that case, I will want to strive to get a minimal number of kilojoules. You'll see that in the jowl, in the upper left, and the forehead. And in that case, I may just come back and do it again.
And retreat it.
Yeah, retreat it, because otherwise you may be risking undertreating.
So once you reach the desired range, how many passes do you make?
Great questions. Okay, so here, what I'm striving to do is sustain that temperature for what you'll think is enough time. In the neck, probably like 10 or 15 seconds. You want to get that pizza wedge of heat at therapeutic for 15 seconds or whatever you think. Maybe you should more relax, so you go 20, in that range. Some docs would just hit the temperature and move on, but I think you should sustain it for an amount of time. That's a fast and beat again. So like in the belly, you may do it for a minute, you know, each area. Depends on what the clinical scenario dictates, right? Good, she's 60 and 39. That's great. So right there, see that temperature pretty much. But I want to keep it all that zone of treatment up at temperature for her. So I'm good there. Good. So it's not like a hard and fast thing. I'm doing 10, 15 seconds on the clock, but I wanted to sustain that for what you think is. It's like when you bogey a flap or something. You do what is needs to do, right?
And the amount's not equal, but we did 1.4 on the other side and 1.3 there. Perfect.
In the ballpark. So yeah. Okay, good. And I wasn't even looking for the kilojoules as an endpoint on the neck. On the face,
1.3.
Okay. How you doing, Donna? Pretty good. Okay, just checking the pathway here. Nice and easy. Good. Here we go. Almost open neck. A little suction, and then we'll do the gel. I just like to do it that way. I'll suction next for a couple reasons. Just because, biggest reason is probably because I don't like change. I always do it that way. But there's some reasons you want to get that fluid and contour the neck first, and then you actually see the jowl more distinctly, then you can kind of look at it more. It's kind of hidden in all this tumescence. Secondly, some of the tumescence may actually come down, because you may not want as much when you're doing it with the face. That's why you do it first. That little book was the TSP. No. Okay, temperature surge. What temperature? Can you tell what temperature surge is, Wanda?
Yes, temperature surge protection is if there's too rapid a rise of temperature, the device will automatically cut itself off to help prevent us from causing a thermal injury. Typically that can come from if we're too superficial or not enough tumescence or fibrous area. So if our rate of rise of temperature is above that 20 to 35 degrees Celsius per second, you will get temperature surge protection. And all Dr. Chio has to do is just to pick his foot up off the pedal and reposition or correct the problem, pick his foot off the pedal and start again.
Wanda says much more eloquently, but basically the machine says, move your, you know what, Chio, keep it moving. Or if I have a stroke and I'm not moving this and my foot's on the pedal, the machine's smart enough to shut off because the rate of rise of temperature is a lot quicker or too quick to be safe, and it'll just have to re-switch, reactivate the pedal. Okay, the internal's getting there. Internal. Good.
The beeps don't tell you internal versus external temperature, right? You're looking at the readout.
It does.
Yeah, it does. That really fast beat. You're kind of, it's kind of hard to tell now in the beginning, but that triple beep, that's external temperature, stops. That quad beep, I think it's 4 times per second, or even faster, is internal.
And you'll detect the difference.
And, and if you have bad coupling, you'll go, that's bad coupling because you're opening the circuit and it'll shut off automatically. And we'll go, I'm just kidding. You win 10 free headpieces.
That's external.
That's external, exactly.
Yeah.
Internal.
Internal. So I'm trying to get everything up.
And you'll even be able to detect when you're getting a combination of both.
I'm sure Donna can hear that sound of almost like crackling. It's actually a good sound. I don't want you to be concerned. That's a fat. Yeah, Lucas, be on this side to get it. Yeah, good. I think we're there. Yeah, sound like that. Let me externally blow. Good. I think I'm good there.
Okay. 1.4.
Good. Ballpark, right?
Did you?
Are you doing okay? Great. Okay, next we're just going to contour, get that fluid out and a modicum of fat. These are spirotheodoral specials. Meteor Motors can't use these. He's out of town, so I'm using them. These are 2.4, 2.7, excuse me. 1.6, which is nice. It's a downfiring one. I don't know if you can see on the camera, and it's a 2.0. The workhorse for most women use 2.0. And some gentlemen with thicker necks, I use a bigger one. And we have a 2.4 somewhere. It's just great. I think this is a great procedure to do in the procedure room in an office. We have some colleagues, aquaplastic and ENT facial plastics here, and I think it's a great adjunct to their existing busy practices. And wants to left part. And we're going to come up with some cadaver videos, more of them, which we did with some of our colleagues, Res Diane and Shar-Pol, Dallas and Austin, respectively. And we're going to go with the Sean's on Sunday and do some more.
It really is the gap procedure. Our client today, Donna's a perfect candidate. She still works. She doesn't need or want the downtime of facelift. And she will be able to be back to work on Monday. And her colleagues probably will not know she's had a procedure done. She might still have a little swelling, possible bruising. Downtime, the post-care is typically what you're going to do now. Many have them wear their garment compression for 48 hours, and then for 2 weeks, they like for them to wear it 12 on, 12 off. It depends, but it's whatever you're using now. It's
basically the same facelift dressing or neck protocol. She's going to go back to work on Monday. She'll be aware of some swelling, but most of her casual colleagues will never be aware. 6 on bottle. Usually put 5 on nylon, but since she's out of town, we'll do the normal sutures.
So it's a circumferential lipo tip.
We got the neck out of the way, more or less. I'll come back and do some fine tuning, but now that we've had the jowl kind of more or less isolated, our marks came off a little bit, just to emphasize this is the no-fly zone, about roughly a centimeter this direction that way, from the marionette line from the modiolus down to that, arbitrarily indicating the jowl, and it's just subdivided 2 areas because of the heating issue. Sinking on this side. We'll show the AccuTite. The neat thing about the AccuTite, if you're not going to suction, as mentioned earlier, is that you can use an 18-gauge needle, and you have a lot of latitude where you can place the puncture, because it's not going to be, won't leave any permanent marks. This working portion is 6 centimeters, 6.5 centimeters or so that up to the hub is as far as you can go. Similarly, I have a external electrode here and an internal electrode here. This one is solid. It doesn't have a Teflon tip, but you don't really need it. Thanks, Steve. Perfect. This is great though, because all kidding aside, it's still 16 watts, so it's pretty powerful, but it's also very discreet, and you have to move a little more quickly because almost the same amount of energy is liberated in the FaceTite in a smaller surface area, so you want to go more quickly.
the settings.
3755, please.
Okay.
So just like a venipuncture with an 18 gauge, you really place it anywhere you want. Before I do that, because I lose that comment. In the past, we used to go this way, and you may have some inadvertent heat transfer close to here. Even if you're not on top of it, just the proximity to heat, because it could be quite profound. You may have a transient neuropaxia. our friend and colleague Paolo Ravali showed us that when you change this direction, and remember we always stop short from our access point, a centimeter or two, that really ensures that you're not going to overheat inadvertently. And he's found that to be very successful, and we appreciate that advice. Okay, it's an 18 gauge. Okay, good. The hardest part is to find the accurate. So just going to arbitrarily do half and half because it heats up very fast. And this is where we come back even if we hit the temperature because we want to get enough kilojoules. See how fast this is? About 40 minutes. Okay. And here I just go on withdrawal because it's such a small area that you're not going to save that much time going both directions. And you also want to be right on the money in terms of the directionality. See how fast that was internal. See that? That's the fast speed. I'm obviously super fast. Stopping short there. You comfortable though? Stay patient. So I'm going to get the external, excuse me. It's okay to start conservatively and go up, and she's starting as well, and the tissues I can see are responding nicely. It's like a drag strip, quarter mile drag strip. Everyone's in this, a lot of people in this series all the time, but you'll get that quarter mile eventually. You're within the 1,000 horsepower funny car, but you have less control than like a 200 horsepower Camry. You get there eventually, so there's no shame in going slowly. You get to temperature and therapeutic. Alright. That's external, that's good then. We get internal, right? That's about 0.4. I might come back, but that's pretty good. We lucked out today. So you may get hung up here, and then even if you're moving the device here, you may inadvertently not have as good a contact. Or more clinically relevant, this part's going to heat up an area that you think has been already done. You might get even more power. But you'll probably feel it.
Okay.
Yeah.
So could you use the FaceTite?
Definitely. Yep. It could.
If you wanted to.
Yep. So you want to be efficient about hand pieces. You can definitely use it. I mean, we're obviously going to do the flap and stuff.
Yeah.
I would definitely use the smaller one for that. But yeah, if you're going to do just jowls and even flap, you can use one hand piece. Much to the chagrin of the company.
Right.
Use them all. I break out the buttons. But all kidding aside, I think here you want to be spot on. This is much easier to use. If you can do a lot of flaps and stuff. You could do a neck with the AccuTite too. The nice thing is you can just make another counter incision with the 18 gauge. It doesn't leave any permanent marks. Good. Good. That's external. Okay, that was TSP, right? That was going too slowly. That's a decent speed. That fast, it was internal. External. External. Was that 60? That's good actually. 60 and 38. And I want to get a full kilojoule. Let me just get back here.
Okay.
So we're at 0.7 now, and say usually I'll say, okay, that's enough, and we'll move on. But I think it's such a small area, it gets heated up fast, and you want to really get the contraction that way. I think it's worth the extra couple minutes to get like a full kilojoule here. I think your tissues appreciate that. External.
So whenever either temperature is achieved, internal or external, the device will not fire. It's a safe thing.
It's very safe, but extremely safe mechanism, but also you have to work with it so clinically you're not getting hamstrung so that you're getting enough energy in. So right now, I want to find a spot to heat up to get that last bit of energy in. Like one that said nothing's being delivered at this point. What is that fast? contractile part of this was healing no one sees it. Okay, so it's hard to find, but which is obviously an advantage.
Right.
Check this right there. Thank you, Lucas. And I'm starting off just on withdrawal. Each successive pass it gets easier. So in the beginning, I'm slow on the draw there.
You usually don't need to pre-tunnel up here.
No, you don't. You know, if they're males, the guys, or they have face up, you want, but you'll figure that out pretty soon. You just pre-tunnel with just a couple of passes with the cannula obstruction. The question, if you can hear what the doctor was asking, if you need to pre-tunnel in the gels, it's just a judgment call. If you feel like you're getting hung up or hanged up, as they say in Georgia, go ahead and
Louisiana too.
Like,
go ahead and feel free to pre-tunnel. Okay, that's internal. TSP. External. 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 Good. Is that 1-3?
Well, 0.3.
1.3, yeah, okay.
I can do that math. On the even numbers. It has a counter reset that you can reset it for each area so that you can.
that total energy delivery.
So I'm being cognizant of that, but I want to get that gel on. External. External. So basically nothing's happening. I'm just finding a place that's not as hot, so it's going to deliver that on right there. So just to get that nice homogeneous treatment done. Happy New Year.
Yes.
That's the phone ox, huh?
Oh, right.
Is our staff getting the phone ox again?
I am in the corner.
If people want iron, you want it. I'll show you that.
0.6.
Yeah, so it's heating up pretty good here. Pretty well. So now I should hit the top. I'm going to go back here where hopefully it's cooled off. You can take a damp cloth and physically cool it off if you want to. Just so you can deposit energy. I guess it's equivalent like another pass of a laser. But I think it's well worth it so you don't undertreat. I'm just playing a little gentle power traction with my knuckle. Internal. External. So you can get a different, the tones. It's got pretty good thing. She's nice and warm. Wait, 1.9?
0.9.
Okay. I think I'm going to quit there because that's enough. I think that's
And I'll
good.
show you the camera here.
So this is it.
Nice and
And
that nice.
a little more to the center, please. Yeah, 40.7 if you can't see the camera. 41.5. That's pretty good. If you can see it on the, if you tilt your hand a little bit the other way around. So basically, we're going to hug the inner table, and it goes to cephalad rotation. You're basically pronating or supinating your hand so that the outer electrode kind of hugs the inner table of the mandible. And we'll see it. This is what we're talking about, the early thermal stuff, like if buzzing down a flap, that's kind of akin to that. And we're just going to probe is at appropriate, internal probe is at appropriate depth, but we're going to really hug it just like that and on the control. It's hugging the inner table. So if they have a tonic submandibular gland or something like that, you may want to consider not doing this, but most people don't. And even then, they're obviously underneath the physical. I'm not sure exactly the physical phenomenon that's going on here. I think it's a combination of some water vaporizing, obviously compressing it a little bit harder. But you can see that mandible coming out nicely there. So, hugging it.
It's kind of like tucking a sheet.
Yeah, that's nice. I like that. Yeah, I appreciate that on the camera. But, yeah. So it just means you're rotating. Yeah, exactly. Hugging the inner table. Exactly. Yeah. The question is rotating cephalad or supinating your hand a little bit like that, so that it's en face with the inner table, so to speak. Here I'm just concerned with the internal temperature, which is right there. Good. That's Dr. Paulo Ravati's maneuver. Finding the proper depth internally, closing the device, and then supinating your hand so that the external electrode is more or less en face with the inner table, and then using your other hand just to turn it. But it does take a little more pressure than average. You see that? Look this up for your angle. Wait a little trick. In the interest of time, I'm going to come back and section it off camera a little bit more, but I got most of it out here. That's good. Let me see that right there.
2% Lido with marking with epi 1 to 100,000, and 0.5% marking. You can do with or without epi, half and half, and then another. So I'll drop. I usually drop a 3 cc syringe total. 2.5 of that will be the Lido and the marking, and then another like 0.5 of the bicarb, and then I usually end up injecting about 1 ml per second.
And then you can do it right away. You have to wait a few minutes. You're good.
You can do it pretty much right away. I use a long 30 gauge, so you can just stick them a couple of times really. It's called MKO Melt. It's midazolam, ketamine, and zofran in a sublingual form. I think it's like 2 milligrams and 5 milligrams, so very low doses. And you can usually give one, takes 15 minutes to kick in, lasts about 45 minutes. Patient dependent, some patients will fall asleep, some patients are awake but more relaxed. So
it's okay to give a second dose for longer procedures?
I think so. I think it depends on the body weight too. You know, for somebody who's small, one is going to be enough, but definitely, yeah. Sometimes if we're doing a blast followed by laser, we'll give a second dose before doing like a full face fractional laser.
So here I just arbitrarily or try to find and fill a notch, and then where I would think that the supraorbital and trochlear bundles are, and then basically you're going to stop our heating at about a finger breadth above the brow. It's super safe, even for going this direction. I'm just going to axis. There's a 1% here, and so use the tumescent for the rest of it. I'm going to start subgaleal, so it's less painful for the patient, but then if necessary, we'll go to thank you.
Så det sier du subgaleal instead of subcu?
Some folks will go this direction, and it's fine to do that way, but I'm just concerned, even if you're not heating where the presumed path of the frontal branch could be, I just think just manipulating that area in general can, because it's relatively superficial there, you may have issue with the nerve. And I think it could come this way. It's crow's feet. I'll leave it there because it's hard to see. So that begs the question. Okay, so we're going to investigate this with the cadaver a little bit more. But then I should do your opinion in a couple months and with Sean's on Sunday in terms of depth. See how fast it is. I'm going to go with control. You okay, Donna? Mm-hmm. That's all internal. Speed up a bit. That's external, good. So what am I at, Jenny?
You are 36 externally and, yeah.
And
Let's
how
go to
many
37,
kilojoules?
please, the next one.
37?
Yes,
Yes.
thank you. Internal.
Internal for 50.
Let's go 55 internal. Yes, it's harmless, really long.
Okay.
So what is the future indication for maybe fat fat lipolysis in the lids? You know, soup fat and all that. I mean that's getting more deep, obviously. Right now we recommend the sub-Q approach at the moment.
Yeah, I mean, because you get liver problems and
Exactly. So this is a safe plane to start with, but I think I'd be interested to see what your all specialties.
The pre-aponeurotic fat is going to be right underneath your probe if you're submuscular.
Right.
Levator is deep to
Deep
that.
to it.
Right. So if you're in the orbicularis muscle is so thin, so technically you probably will get some lipolysis. The question is, again, because now the spectrum has shifted towards keeping fat, the only area that in most people you want lipolysis is medial. You really kind of want to preserve that central fat pad, right? Because that gives you that fullness.
Right.
But I think medially a lot of times it is deep.
Yeah, it's
So-
pretty deep. Okay. No,
Yeah.
we appreciate your input for sure. We have an active plastic surgeon. This is great. So on the table, you see some of the water gets vaporized, but and it's just some from the just compression. But it's hard to tell on table. But I think we're gonna go by kilojoules here. She's a candidate for a standard excision, which obviously doesn't preclude that later on. But this is a good procedure for that now. Check my plane. Once again, as discussed, for sub-Q. Thanks, John. Control. Internal, good. Ballpark. So just to review, about 5 or 6 cc's per upper lid. We're at what settings again, Johnny?
We have 37 externally and 55 internally.
And we put about 0.2 kilojoules on the right upper lid. And we got what, 0.1 or so right now?
Yes.
Okay, so we hit our temperature pretty quickly, so I mean, maybe internal, there's an internal, good. We hit 0.2 yet?
Yes.
Okay, good. Then yeah, it definitely feels nice and warm here, even though our settings are more conservative obviously elsewhere. I think that's appropriate for the left. Incidentally, you can actually fit the, I think I mentioned earlier, the FaceTite also fits an 18 gauge also, but there is some dilatation of the access point because It's 1.1 millimeters or so. That's okay, Steve, I got it. We are above the apicularities. Okay, so once again, we're just in the sub-Q space, checking the dissection plane, which we already did with the infiltration. At least a finger breadth above the supraorbital rim, for me at least. I think if, as we gain more experience, if I creep up closer, keep in mind the neurovascular bundles, of course. Oh, ranch. And we're in the same setting. Right?
Yes.
37?
37.
Let's go 38 and 60. Thank you.
Right.
Thank you. Heating on withdrawal. Very quick. That's external. I'm going to slow my rhythm down a little bit of cadence. You okay, Donna? I just saw your eyebrows go up a little bit. I'm glad they're still going up. That's good. External. What's my internal, John?
You are 60 and
Oh, 60 is good. So the camera can pick that up as appropriate response to the earth theme there. Actually, Wanda or Johnny can talk about the Morpheus while we're doing this, finishing this out.
Okay. Following the procedure, while she's nice and numb from the tumescence, we're going to use our Morpheus8, which is delivering RF energy through pins. We have the advantage of the Morpheus8 is that we can set the different depths as to the body area that we're working. We can be at 2 millimeter, 3, or 4. So this will get us a little extra tightening, a little icing on the cake for Donna. Quick recovery.
How many passes and all that would you recommend?
Typically, around the eyes or forehead, we would do no higher than 20 of our power. On the face, we can go anywhere from 20 to 30, 35. The neck, we typically do 3 millimeter at the neck, and the same with Donna having nice.
You have a little pain, or we put a little more.
What'd you say about the neck?
The neck will usually do 3 millimeters. We might decrease the energy depending upon the integrity and the health of the skin. Donna has nice, healthy skin, so a power of 30 is would be very appropriate. We can even double stack on problem areas such as nasolabial fold, submental, the jowling area, which means we'll fire 2 pulses. The device allows us to put it in a fixed mode and do that. As long as our foot is on the pedal, it will continue to fire. On our cycle mode, the pins will extract and retract with every pulse. They're all coated needles. They are, of course, a high grade stainless steel coated with a gold coating, and our energy is only coming out of the distal 0.2 millimeters of the tip. This being coated allows us to use it on all skin types.
So is one mode more appropriate than another mode? Or it's
Cycle
just
versus
whatever?
fixed?
Yeah, exactly.
If I'm going to stack pulse, I'm going to be in the fixed. If I'm just going to single pulse around the eyes, the forehead, thinner areas, I would be in the cycle mode.
So you don't use the needle twice.
You'll see, we're going to follow up with this, and it's really nice. Before we begin, we will clean her skin, take everything off. We want to work on nice, dry, clean skin.
Yeah, how would we do that?
03.
Okay, that's good, right? We're done.
How effective is topical anesthetic? It depends on your client, of course, and the anesthetic you use. We recommend a 23% lidocaine with a 7% tetracaine and a plasticized gel. And many tolerate it very well, with or without little oral anesthesia. I had a procedure maybe 10 days ago. My settings were aggressive, just with a topical, and I did fine, no problem. Yeah.
Is there a number of pulses where the needles get blunt, or is it unlimited?
It's unlimited.
Practically
It's unlimited. I mean, we want to check our tip to be sure it's kept clean. And we can just clean it with the tip with a 70% isopropyl alcohol. I have personally seen a tip use 3,000 pulses, and I've had feedback from the field where it's been used up to 5,000, because we use it anywhere on the body. Great for stretch marks, little added tightening combination with body tight.
What about like acne scar?
Great results with acne scarring. We do not have studies as of yet with Morpheus and acne scars. We do with our Fractora, which is our other device delivering RF energy through the pins, or commonly called microneedling RF. But wonderful for acne scars.
Great. I'm just doing a final touches on the liposuction portion, then we'll do the Morpheus shortly. I just want to finish the sterile portion of the operation. Of course, the Morpheus tip is sterile, but the handpiece is not, so we want to just keep things sequential.
The Morpheus tip, as with the body tight handpieces, FaceTite, AccuTite, are a single, one-time use only.
The Morpheus, I think, is unique in that space because it goes through the dermis entirely into the FSN. This is a pretty efficient operation. You can do this in under an hour, pretty much.
So face is for 3 millimeters when we are working at 3 millimeters. Periorbital is 2 millimeters, and body is 4 millimeters. So then we have the energy that the provider will suggest. How much juice do you want?
Let's do 40 in the neck.
40, okay.
Which is that what's the maximum setting one?
On our QRGs, 40 is the maximum.
Okay. But the machine goes up to 70.
Correct. 62.
62.
Correct.
Okay.
And well, fixed or
Fixed, yep.
Fixed.
I like fixed.
Yeah, fast 1.0.
1.5, please.
1.5.
That's pulse per second.
Yes.
So faster the better. Hopefully you can get even higher with the next iteration. Okay. And if you can see it, it comes out.
It
Very
does
nice. Have good contact. Double pulse, double stack rather. 50% overlap. I think you guys mentioned that.
Nice firm pressure, as you see.
Remember
Ensuring that all edges are in contact. Perfect.
You can do this without tumescence if you do only Morpheus.
It does stimulate, but you can definitely do it as a standalone procedure, absolutely. But I would recommend a little bit of something like a nerve block or something, because it is pretty robust.
I mean, as far as the depth control.
Yeah, we're on a face which is 4 millimeters.
Okay.
3.
Excuse me, 3. I think in most states, your physician extenders can do this part, but I just do it over here, and I do it anyway.
So is the patient going to come back to have this part done again usually?
No, you can only
Or
do it once usually.
The Morpheus is
That's
one and
yeah,
done?
that's
Right.
a good distinction.
And it depends on the degree of correction needed and how aggressive you are with the procedure, for sure.
He has higher energy, but it means less persuasive. And if you do just with topical, you will not be able to get probably that much energy.
So then you can repeat it like once a month?
Right. Many sites that have a medical spa area, they will have their extenders, as Dr. Chio called, use much less settings, power, and there will be a series of treatments. And very well tolerated under topical anesthetic. But in with this type of anesthesia, great
Is it
skin.
40 right now?
Yes.
What would you do for this cycle? Like this sets of 3, what would you put it at?
The cycle helps new providers that does not have ability. The needle retracts and give enough time for them to place correctly
No, I
relieve
mean,
the energy.
you said when you use lower energies, when you're not doing it as an edge on
20.
You said 20? Okay.
20. And if I have a dark skin type, especially if they have a history of PIH, I would definitely begin with lower energies, 10 to 15. You can always safely, to be safer, pre-treat with any lightening agent, pre-procedure and post-procedure.
Okay.
If you have skin that you know tends to post-inflammatory hyperpigmentation.
PIH. I like PIH. It's easy to say.
Yes.
This is about exciting watching paint dry, but
So you're overlapping
50%.
50%.
Yeah.
And then you're doing a couple of passes?
So double stacking means you're creating one channel and doing 2 pulses in the same channel,
Okay.
and then 2 passes, which randomizes the pores, the channels.
That increases our density, treating more tissue.
You don't have to turn it, like sometimes with lasers, you have to turn it 30 degrees or something. No,
The inside where the pins extract are the same, whichever direction. So which is most comfortable, and to cover that area, you can turn the handpiece.
Yes, it's good because I forget which is which, but the pins are the anode or cathode, and the other one is the surrounding, the other, his partner is around here, so it's really easy to.
So the
keep track.
the pins are our positive
Using case
electrodes,
model
positive
now.
electrodes, and
Yeah.
the surrounding
So it does 2 beats,
stainless steel
2
net
minutes.
meshwork is our returning. So and typically after
If it's a little
24
red,
to
you put a
48
little
hours
concealer
when
on
the
the neck
channels
or
are
whatever,
closed,
but
they can go
I
back
don't
to
have one.
sunscreen and moisturizer.
And exercise?
I would wait the next day to let the pores
Or-
close up.
Chris, how about exercise a week or?
Yeah, I tell them 2 weeks.
2 weeks.
You'll see them in a week and you can reassess them. You know, some people are just need to exercise. We want to mention the PRP for those of us who do PRP. I hope you guys do that.
A lot of people are using this because we do have open channels, and immediately post-procedure, apply PRP. Some are even
That's 380 per
asthmas.
neck.
There
You
was
do the gel now?
using
You
a
want a
procedure
zero?
like this and
Yeah,
then
you can
applying
zero.
Sculptra right
You
on
keep the
top.
same
And the
settings.
results that they showed was really
I think we'll do the same
amazing.
with
Topical?
Topical
Just
Sculptra.
diluted?
Diluted topical Sculptra, yes. So there's, now that's not company endorsed, but
Right.
we are seeing that for sure.
Are we still on?
Yes?
Okay. I think we could probably wrap it up with the, I'm going to do the forehead, I guess.
Okay.
More of the same. We appreciate everyone here today, especially Don, our patient,